Joining us now is Seth Denson, the president of the insurance agency GDP Advisors. So, Seth, regarding this recent outbreak, it's kind of raising a lot of questions about our healthcare system. I want to start with what a lot of progressives say, that this whole situation kind of demonstrates why we need a Medicare for all type of system. Do you agree or disagree with that sentiment?
Has anybody that's needed to seek treatment for coronavirus not gotten that treatment as a health insurance issue? This isn't an insurance issue. This is a healthcare pandemic. This is a totally different thing. And I think we can have the conversation about expanding healthcare access, but our challenge in the United States with healthcare is cost, right? And that has nothing to do with insurance. And so when we start talking about Medicare for all and government intervention and government-run healthcare, the reality is what's getting us through this pandemic is the private sector.
No, I think you're right. And I think that there's something to say about the mortality rate right now in the United States compared to other countries such as Italy, South Korea, people who have gone through this already. And the fact that the U.S. mortality rate is lower despite the testing picking up right now is a testament to how good the U.S. healthcare system is, what our doctors are doing, what our nurses are doing, and everything like that. Do you foresee, for example, the healthcare system, the hospitals being overrun at some point the way a lot of people are expecting? Or do you think that this will kind of be leveled off with the curve, as people are saying?
Well, I think there's no question that, as a matter of fact, I was visiting with a doctor just earlier today who runs an emergency room clinic or emergency room, and he's telling me that the social distancing, what we're doing now to bend that curve is actually working, and we're starting to see that. But not only is it working for coronavirus, it's working for everything else. We're still in cold and flu season and allergy season and all this other stuff. So this keeping people apart, while it isn't something we want to keep doing, it is kind of helping bend that curve in most parts of the country, right? We recognize that New York is an outlier, some parts of California are an outlier, but for the most part, the country's been able to manage this rather well because of this.
And of course, this comes when people would debate whether or not the lockdown kind of meets the needs of what's happening to the economy. There's economic hardships. We also want to make sure that hospitals aren't overrun, as we were saying, which is the reason why a lot of state governors have made the decision to kind of close down businesses for the time being. Do we have any indication of whether or not that is a long-term type of proposal, if it's sustainable from a financial aspect, or if this is something that the coronavirus will play out? I hate to compare it to the flu, but that is something that a lot of people are comparing it to, saying that this might be a cyclical type of thing that we need to be ready to address on a year-by-year basis.
Yeah, most of the experts that I'm talking to are saying that this is going to likely become a seasonal thing. But there's a couple of things that we need to keep in mind as it does become more seasonal. One is we're working on a vaccine treatment. We also have what's called herd immunity, right? Which means effectively, right, when we start to get, our bodies are the most powerful healthcare mechanisms there is, and when our bodies are susceptible to things, they learn to fight them off. And I think that most of the medical community is recognizing that as this thing comes around a second time, we're going to be more prepared as a healthcare industry. There's going to be better treatments and vaccines, but our human bodies are going to be more prepared to address this as well.
And I think that's a big point, too, because, I mean, the whole idea of leveling the curve, as we're saying, is so it's not overrunning the healthcare system right now, that people aren't just flowing into hospitals. And as you say, that's not happening right now, which is a good thing. I think a lot of people should acknowledge the good work that the American people have been doing in order to kind of help our nurses and doctors in that effort, because, I mean, those are people that are being exposed to the virus on an almost daily basis as they deal with these patients. So acknowledging that point, too, what is the next step for the government after this, or if it's not even the government's job? Is it the private sector to kind of make ventilators, make things that kind of meet the demand of where we are right now? Is that something that we'll see kind of ticking up over the next couple of weeks?
Yeah, I think so. And to your point, you hit the nail on the head in the fact that the government doesn't own a bunch of factories to go out there and make ventilators and the products, the PPE products. And that's really the big concern here right now is these PPE products, these protective gears that protect our healthcare workers and first responders and all of that. And so the private sector is stepping up. I think you'll see that ramp up. We're already starting to see a reduction in the number of cases in certain parts of the country that were hotbeds. And I think that those parts will start to see the peak. We probably haven't seen the peak in some other areas. But again, as long as we continue to do what we're doing now, we're all working together. This is making America stronger as a unified group. Then we'll get past this and we'll overcome it. We'll be ready better for the next one that comes around.
And I wanted to really quickly speak on the idea of kind of the public-private partnership that we're seeing right now, because it's something where a lot of times taxpayer dollars do go into funding a lot of these vaccines or research from these private medical companies. That's why a lot of times they get governmental funding. Is that something that we are just kind of seeing right now because it's kind of at the forefront of what's going on right now? Or is this something that happens kind of frequently and something that maybe we should start addressing a little bit more?
Yeah, no, listen, there's always government funding structured for pandemics and looking at different viral things and different treatments for different things. The government has grants and funding and things like that. But listen, make no mistake that 70% of the world's innovation in healthcare comes out of the United States, and it comes from the private sector. So if we want to start to squeeze the private sector, we can kiss innovation goodbye. The rest of the world that has socialized medicine gets to do that because we don't here.
Yeah, and I think it's kind of, I don't want to say funny, but maybe a little bit ironic that the pharmaceutical companies are the bad guys all of the time, except for the time where we need them, such as right now. They're at the forefront of all this. They're the ones researching vaccines, kind of looking at what we can do in order to help the average person. All of a sudden, they're not the demonization of what we've made them out to be over the past couple of years. But Seth, I appreciate you coming on, breaking down the healthcare industry. Never an easy topic to discuss. Thank you for joining us tonight.